have Dr. Pinkie Agarwal come back up, and as you already know her quite well, so she doesn't need any introduction.
So one important thing to know about trials is that you can continue getting care from your own provider. So if you participate in trials at any of these centers, whether it's at Swedish, Virginia Mason, whether it's at Evergreen, UW, any of these, you do not need to change your treating provider. So you can participate in a trial as well as continue care with your, the provider that you're used to, that you've been seeing for years. So I've kept some of my slides very broad and not very detailed. So the main categories that we are having trials in Parkinson's at the Booth Gardner Parkinson Center is for patients who are recently diagnosed. And that question came up, that what do we mean by, say, young onset or newly diagnosed? So these are patients, for here we mean patients who have recently been diagnosed and who are not yet on any dopamine treatment. We also have trials for motor symptoms and non-motor symptoms. So you heard a lot today about immunotherapy. And then, so we are doing, the Biogen Trial, which is basically antibodies to alpha-synuclein. And that is for patients who are recently diagnosed, not yet on any dopamine treatment. Now, the trial, it's a long trial. There are monthly visits. So initially, to confirm the diagnosis, patients would get a DAT scan. And then if you do end up enrolling in the trial, there would be monthly infusions. So you come into the clinic and you get an infusion once a month. And then at the end, everyone gets the active treatment. So nowadays, there's an increasing focus to make it fair for everyone. This morning, we've heard a lot about placebo, and that some people get placebo, some people get active. Now, what they're trying to do for trials is to make it fair to everyone, that the patients who are on the placebo arm also in some trials will now get active drug after they end the placebo arm. So that way, no one leaves the trial thinking that I might just have been on the placebo. So in this trial, you do have access to the everyone gets access to the active drug after some point. We also have for recently diagnosed Parkinson's, a medication that involves a combination of two known agents. We already know there's pramipexole and there's rasagiline. So the question is that if we combine these two drugs at lower doses, perhaps we could have the best advantages of both drugs, maybe with less side effects. So that's another option. You heard a lot today about GBA mutation. So we are doing that trial too at the Booth Gardner Parkinson's. Now, for some of you, you may know your GBA status, you may not. So it's possible to come into the trial and get yourself tested. And obviously, you make it into the trial if one does test GBA positive. We also have trials for motor symptoms. So we know that after some years into Parkinson's, sometimes people will feel that their meds are working or not working. So those are called motor fluctuations. So we do have several trials for off time, where if you feel meds are working or not working, then you may be a candidate for those trials. And some of them are looking for novel ways to deliver dopamine, which could perhaps stay in your system longer so that you don't have to take meds that often. Or it could be something that bridges the gap between two dopamine doses. Now, we know that sometimes when one is taking dopamine long enough, sometimes there'll be some involuntary movements or dyskinesias. So there's a trial going on for a medication that might help with dyskinesias in Parkinson's disease. Some people have a preference for not taking a medication. They'd love to participate in research, but at the same time, they don't have the time commitment it takes to make the multiple visits. So for them, there is this electronic diary study. Basically, if you've ever had on or off, right? So you know what it means to be on or off. They're trying to develop an app to capture these symptoms online. Right now, what happens is you go to the doctor's office and you try to recap 4 months worth of data. So the doctor will ask you, oh, how long do your meds work? How long do they last? When do you have off time? When do you have dyskinesia? It would be great if you could capture this in real time so that when you go to the doctor's office, you can just download that information that's been captured in real time. So you waste less time and you get more accurate data. So in this trial, there are 2 visits. You come to the first visit and you're given a smartphone, and then they show you how to use it. Then you take it home, and then every day you capture some data on off time and how it affects you. And then you come back in about 8 weeks and you return that smartphone with the data downloaded on that. The hope is that at one point this will convert into an app that you could all have on your cell phones, so that you capture that data in real time when you come to your doctor's office. So this is a trial that does not involve taking any medications. It's just an observational data capture trial. Now we know a lot of problems in Parkinson's can be non-motor, and some of those can be memory problems. So you might have seen advertised on TV, there's an Eli Lilly trial. Some people came and asked me about it. So we are doing that trial. It's for cognitive problems in Parkinson's. It lasts about 4 months long. We also have our own trial, which our researchers have designed. It's looking at a medication called Suvorexant in people who have trouble falling asleep or staying asleep with Parkinson's. Dizziness on standing up is a very common symptom in Parkinson's. And sometimes you try to increase hydration, you try other strategies. However, there's also a new medication they're trying to develop for dizziness on standing. And last of all, we do have another trial for mood problems, so if someone has depression. The good thing about this trial is there is no placebo arm because it's still early. So there's no placebo arm. Everyone gets active drug. It's about 8 weeks long. So you'll find more information about our trials in this flyer that's on our table outside. So thank you for your attention.
You can see that Dr. Agarwal covered quite a number of different clinical trials, a wide range of different symptoms and different stages of the disease. And so in addition to the excellent handout that you can get from the booth, they also have a website as well. So I encourage you to take a look, and the website is updated quite frequently. So if nothing fits you today, and if you're not interested or ready today, check back in 6 months or a year.